Bianca Castaneda, and this is my trach care OSCE video. I'm gonna walk into the patient's room. I'm gonna do hand hygiene. Hi, I'm Bianca. I'm gonna be your student nurse today. How's it going? All right. So line of communication. Did you want to do a thumbs up for a yes and a thumbs down for a no? Sounds good. All right. First name and last name. Thumper Rabbit. And your birthday, September 28th, 1999. Awesome. Do you have any allergies I need to be aware of? No allergies? Awesome. Sounds good. So I'm going to do your trach care. I'm going to start by suctioning your catheter, and then I'm going to change out your inner cannula and then change out your stabilizer. Sound good? All right. So I'm going to go ahead and assess his vitals. I'm going to check for heart rate, blood pressure, respiratory rate, temperature, and his O2 sat. I'm going to go ahead and attach this O2 sat monitor, touch it, make sure that it's reading, and then I'm going to check for pain. So do you have any pain right now? No pain? All right, I'm also going to check for respiratory effort as well as lung sound. So I'm going to do both at the same time. Looks like he's having even breathing, no labored breathing. And his lung sounds good, just a little bit of crackling, but the suctioning should help out with that. Okay, now I'm going to check for patient understanding. So I just want to clarify that you understand. We are going to start by suctioning your tracheostomy, then we're going to change out your inner cannula, and then we're going to give you a new stabilizer. Sounds good? All right, so I'm going to go ahead and come over here and gather all my supplies. I'm going to set them off to the side, and I'm going to sandy wipe the table. So I'm going to do hand hygiene, put on my clean gloves. Hold on. Sorry. Okay, the supplies I do have are 2 trachs, one a current size, one a smaller size. I have an inner cannula. I have a new inner cannula over here on the side that I'm going to change that one out with. I have an ambu bag set up to the side. It'll be attached to working oxygen later. I have a working section with a suction catheter set up to the side that will be set up to 120 millimeters mercury. I have a trach kit. I have a suction catheter sterile. I have a sterile disposable container as well inside the same kit. I have sterile saline, I have goggles, mask, and I have sterile gloves as well as a towel. And my hand sanitizer, of course. And yeah, should be good. I have a new stabilizer and I'll get that later. So I'm going to go ahead and sandy wipe the table, grab a sandy wipe the entire surface, get the corners, cover everything. Toss that, wait 2 minutes for it to dry. And then I'm going to repeat the same thing, get a new sandy wipe, the whole process. Toss it, wait 2 minutes for it to dry. Then I'm going to do hand hygiene. I'm going to save these gloves. So I'm going to toss these gloves appropriately. So I'm going to save these ones. Okay. Hand hygiene. I'm going to place all my supplies onto the table. I'm going to go ahead over here, close the curtain, close the door for privacy. I'm going to raise the bed up to my waist level and to semi-foulers. I'm going to give the patient a towel. I'm going to put it right over here to catch anything that comes out and to protect him from it. Okay, I'm going to set the towel right there for now. I'm going to explain the procedure one more time. So to clarify, I'm going to start off with suctioning your tracheostomy for right now. Then I'll move on to the inner cannula and the stabilizer, all right? Okay, now I'm going to go over here. Actually, I can go to the ambu bag. I'm going to go to the ambu bag. I'm going to attach the ambu bag to working oxygen. It'll be at 15 liters of oxygen, delivering 100% of oxygen. So now that that's all set, I'm going to make sure it works. It should does. And I'm going to go over here. And I'm going to don on my goggles and my mask. Hand hygiene. Put on my new clean gloves. Okay, now I got my new clean gloves. I can go ahead and take my suction catheter kit. I'm going to open it up. This is a sterile kit. Okay, I'm going to grab from the very corner the sterile container. So I'm going to open it up, get the sterile saline, and pour it in halfway. Now I'm going to grab my suction catheter. Grab it here in the corner. Okay, I have my suction catheter. I'm going to go ahead and attach it to the suction. So I'm only going to touch this. I'm going to get my suction catheter and attach it. Make sure it's at 120 millimeters mercury. I'm going to test that it works by closing this. And it does work. I will leave it on top of the suction, but right now I'm going to leave it over here. Okay, now I'm going to attach my ambu bag and hyperoxygenate the patient. So I'm going to go ahead and take this off. All right, I'm going to start hyperoxygenating you. I'm going to go ahead and deliver 3 breaths. So starting off with 1, 2, and 3. Awesome. How are you feeling so far? Feeling good? All right, I'm going to come over here. I'm going to take off my gloves, which I'm going to save again. I'm going to do hand hygiene and start the sterile procedure. So I'll toss these. Hand hygiene. Actually, let me adjust that. Hand hygiene. And I can start my sterile glove procedure. So I'm going to grab this from here. Okay, I only touch the inside of my gloves. I'm going to prop this one open. Okay, nice and over. Now I can go ahead and start suctioning. So I'm going to start by grabbing my suction catheter. I take this one out. I'm going to wiggle it out a little bit so I can get more of the tube. I take just the sterile tubing. I can go ahead and start suctioning. So I'm going to take this over here. I'm going to test that it suctions with the sterile saline. It does. So I can start suctioning the catheter, or suctioning the tracheostomy. I'm going to insert this very carefully. Be sure that it only touches the tracheostomy. Feed it inside. When I feel resistance, I'm going to pull it out. This is a total of 10 seconds. Or if the patient coughs, I'm going to pull it out. And I'm going to start suctioning on my way out. Total 10 seconds. Awesome. Now I'm going to go ahead and wait 30 seconds for the next resuction. And if I do want to resuction, I have to clean this first. So I'm going to clean. All right. And I don't feel like it needs to be resuction, so I'm going to go ahead and just toss this. If he needs to be hyperoxygenated, I will, but he doesn't. For now, I'll just replace the O2. Okay. I'm going to go ahead and dispose of this. And I can dispose of my sterile gloves. And I'm going to start with the inner, or start giving him a new inner cannula. How you feeling? Feeling okay? All right, good. Okay. So I'm going to go ahead, don on my clean gloves again. I only got 1 pair. So I'm going to put on my clean gloves properly, and I'm going to grab my trach kit and my new inner cannula. So these are sterile procedures, so I do have to be careful with this. I'm going to open it up like this. Leave it open. I'm going to get my new inner cannula. I think that landed in securely. Just opened it. Okay, so then now that that's sterile, I'm going to go ahead over here, take off my gloves, and I'm going to start sterile gloves. Do hand hygiene. Comes that. Okay, I'm going to take it right here. I'm touching it instead of my gloves. There you go. Okay, I am now sterile. This is my non-dominant hand again. So I'm going to use this hand to remove the oxygen source. And then I'm going to use it to stabilize the faceplate. I'm going to go ahead and pinch the flaps, twist it, and pull it out. I'm going to toss this into the appropriate receptacle immediately. I'm going to grab the new inner cannula. I'm going to grab the new inner cannula, and I'm going to place it inside of the new tracheostomy. I'm going to twist it. When it locks into place, it is good. I'm going to remove the dressing. Stay. I'm going to remove the dressing, toss the old dressing. I'm going to replace the oxygen source, but this one won't stay anymore, so I'm going to replace the oxygen source. I'm going to assess the site. The site looks good. No redness, no swelling, no drainage. I'm going to assess the tracheostomy appliance, make sure that it's still in place, which it is. There's no redness around it. And I'm going to check the stabilizer. Stabilizer looks good. All right, and I can start cleaning it. So I'm going to take the Q-tip, and I'm going to clean over the faceplate. His hands will not be happy. I'm going to toss this, grab a new Q-tip, go over the faceplate, and I'm going to repeat that procedure underneath the faceplate and around the peristomal site. Okay, now that it's all clean, I'm going to go ahead and grab a dressing. I'm going to pat it dry. Pat as much dry as I can, and I'm going to grab a new dressing and I'm going to put it underneath the faceplate. There you go. He's got new dressing, so I can go ahead and remove my gloves. I would toss these gloves and not put them on the table. Under there. Hand hygiene. I'm gonna grab the new stabilizer. At the same time, I'm going to call the nurse. I'm going to say, nurse, please come assist me for a stabilizer change. She'll come. We'll both do hand hygiene. And last time with the clean gloves, we are both going to change out the stabilizer. Okay. So the nurse is going to come over here. She's going to stabilize the faceplate for me. I'm going to remove the straps one by one while assessing for skin breakdown. I see that there's no skin breakdown on either side. I'm going to remove the old stabilizer. I'm going to attach the new, or I'm going to remove the old stabilizer, and I'm going to attach the new stabilizer one side at a time. Okay, I'm going to Velcro it into place. And it's going to be a 2-finger fit. I'm going to reapply the oxygen source. And then I will say thank you, nurse, for your assistance. And I'm going to dispose of everything I don't need anymore. Dispose of that. Let me put that over here. And I'm going to take off my gloves. Toss those. Hand hygiene. Alright, thank you so much for bearing with me. How are you feeling so far? Feeling good? Alright, I'm going to lower the bed. I'm going to check for the emergency equipment, that the suction catheter is in place. I'm going to make sure there's a call bell as well, which there is. So if you need me for anything again, I have the call bell right here. Just press the button and I'll come to you, okay? I'm going to reassess the patient as well. So I'm going to go ahead and reassess your vitals. I'm going to check for oxygen saturation, check for pain, and I will listen to the lung sounds again. So I listen to the lung sounds again. 3 side rails up, everything looks good. All right, thank you so much. Have a good one, okay? I'm going to do hand hygiene, and then I'm going to leave the room, and I'm going to document the date and time, the patient tolerance, the peristomal site assessment, vitals and oxygen, respiratory assessment, and color consistency in the amount of sputum. Okay. Please let me record it. It did.